Hi everyone, welcome back. So today's topic was actually provided by one of our YouTube subscribers. So please subscribe today and let me know what topics you want to hear about. We have a bunch of really great ones that I have planned in the coming weeks, so stay tuned. Today's topic is postmenopausal bleeding, and it's an extremely important one. And so what I want to do is basically let you know when you should be concerned and also what happens next when you have postmenopausal bleeding, because I think those are the main questions that every woman should know. So menopause itself is defined as 1 year of no periods. So when you go a full year and you no longer have periods for that year, after that is postmenopause. So that 1 year is menopause, basically. So it's defined as 1 year of no bleeding. So if you are postmenopausal and you then notice you have spotting or period bleeding or really any kind of bleeding, then you should be concerned. You should definitely let your OBGYN know, and you should press for an appointment soon. So if they give you an appointment for a far time out, you really want to call back and say, look, I have bleeding after menopause and I really do need to be seen. So what happens? So let's say you have a bleeding and it's 5 years out from menopause. We definitely need to evaluate it. So the next thing that happens in your evaluation is you have something called a transvaginal ultrasound. That's when an ultrasound probe goes into the vagina and basically evaluates the uterus, the tubes, the ovaries. And so what we're looking for there is we want to look at that inner lining, that endometrial lining, we call it. And we want that lining to be less than 4 millimeters. That would reassure us that there's not a lot of cells building up in your uterus. If the lining is more than 4 millimeters, we're concerned that there's too much lining there. This could represent a uterine cancer. It could represent hyperplasia, which is just excess cell growth in the uterus, but it needs to be evaluated. So that is the main test that we look for after menopause to be able to assess that risk of uterine cancer. Now, most bleeding after menopause is still okay, especially if it's spotting. Most of it does fall under the umbrella of what we call atrophy, which means dryness. So a lot of women will have a little bit of spotting after menopause because the vagina is dry, because the uterus is dry, and that is fairly common. But we do want to rule out and make sure that there is no evidence of any cancer of the uterus. And bleeding is the very first sign of uterine cancer. So we want to be really careful about evaluating and doing that next step. So what I want everyone to know is that if you develop bleeding after menopause, you definitely should push for an appointment, and you definitely want to go and have a transvaginal ultrasound performed so that that uterus can be better assessed. And these are the two things that you really want to push for, just to make sure that there's no evidence of uterine cancer.